All right, welcome everyone tonight to this OKA-led webinar on exercise recommendations for pregnant individuals. We are very honored and privileged to have with us Dr. Michelle Mottola tonight to share some best evidence with us in this space. Dr. Mottola is a professor with a joint position in the School of Kinesiology, Faculty of Health Sciences, and the Department of Anatomy and Cell Biology in the Schulich School of Medicine and Dentistry at the University of Western Ontario. She's also the director of the R. Samuel McLaughlin Foundation Exercise and Pregnancy Laboratory. She's chair of the Maternal, Fetal, and Newborn Health Division of the Children's Health Research Institute, and she's a fellow and founding chair of the Pregnancy and Postpartum Special Interest Group of the American College of Sports Medicine. Also, congratulate Dr. Mottola. She was recently appointed as a fellow of the Canadian Society for Exercise Physiology and the Canadian Academy of Health Sciences. And what I think is particularly important to us, and this is another reason why we're very lucky to have Dr. Mottola with us today, she was the co-lead author on the 2019 Canadian Guideline for Physical Activity Throughout Pregnancy and helped to develop the Get Active questionnaire for pregnancy, which is, I'm sure, a tool that, that many of you may already be using. So very excited to have Dr. Mottola with us today. She's going to share some insights and evidence with us for the next 40 to 45 minutes or so. I encourage you to use the Q&A function in the Zoom meeting to ask questions. You're welcome to post your questions at any time during the talk. And then once Dr. Mottola wraps up, we'll walk through those questions and have a chance for Dr. Mottola to answer some of those questions at that time. So without further ado, thank you so much, Dr. Mottola, for joining us today and sharing some of your research and insights on recommendations, on recommendations for pregnant individuals.
Thank you so much, Steve, for your kind introduction. And I'd also like to thank the organizing committee for OKA to inviting me here today. And before I start, I want to welcome everyone. But before I start, I just want to acknowledge that in London, Ontario, I live, learn, and work on the traditional lands of the Anishinaabe, the Haudenosaunee, the Lenape, and the Conoctitun peoples, who are contemporary stewards of the lands we all now share. So I just wanted to acknowledge where I am situated in London, Ontario. So thank you again, everyone, for coming tonight. And what I'd like to do is to talk to you a little bit about what I'm going to go through with regards to the objectives. So I'm first of all going to start with an overview of the developmental origins of health and disease that is affectionately called the DOHAD, and also called the Barker hypothesis. Dr. Barker was the one that kind of coined all of this, and I'll explain that in a moment. I also want to talk about why being active is extremely important for both mom and baby. And then I'm going to talk about the Canadian Physical Activity Guidelines. I'm going to give you a little bit of insight into how these Canadian guidelines were actually developed. And then I want to talk about ways to be active throughout the day, because as you'll see from the guidelines, it's actually a 24-hour guideline, potentially. It's not there yet, but certainly we can talk about how being active is extremely important during the day. And then I'd like to talk a little bit about key factors for exercise prescription, especially for those of you who actually may have pregnant clients. And then I want to end off with, as Steve mentioned, the Get Active for Pregnancy questionnaire from the Canadian Society for Exercise Physiology, and also the Healthcare Provider Consultation Form. And both of those tools are available at the CSEP, or Canadian Society for Exercise Physiology website. So I want to start by way of introduction. And this is kind of, I'm an embryologist by trade. So when I talk about this, it's very interesting for me. But when you think about it, the egg that formed you was created when your grandmother was pregnant with your mom. And that just kind of blows your mind, right? But what that means is that when your grandmother here, this first generation, was pregnant with your mom, who's this fetus here, you were actually being developed as a reproductive cell or an egg within the fetus, which was your mother. So the fetal environment and the maternal environment is extremely important in pregnancy because it may actually affect 2 and 3 generations in the future. And so this is, there's a certain interesting scientific literature on epigenetics, which talks about fetal programming. You'll probably hear my cat in the background. I apologize. He's very vocal. But this is all about epigenetics and fetal programming. So with regards to the developmental origins of adult disease, or the Barker hypothesis, or DOHAD, we talk about adverse influences early in development, especially in utero, because these results may cause permanent changes in the physiology and in metabolism, resulting in increased risk of disease in adulthood. Now, that may have bad events, which would be chronic disease risks for things such as alcohol abuse or smoking. But there are also good events that we can promote during pregnancy, such as healthy nutrition or physical activity, which could be also used for setting the stage for a healthy lifestyle. So when I look at what's out there in the literature, to me, it's very interesting when you think about risk factors. And one of the common links, I think, to chronic disease is physical inactivity. And I'm probably preaching to the choir, but I think this is really important, especially during pregnancy. So physical inactivity can be linked to excessive gestational weight gain. It can be linked to gestational diabetes mellitus, or diabetes that's first diagnosed during pregnancy. And it can also be linked to obesity during pregnancy. And because of this, it may put the mother and the baby at risk with physical inactivity, so that downstream effects could actually put the mother and the baby at risk for type 2 diabetes, cardiovascular disease, and even metabolic syndrome. So I want to first of all just very briefly talk about excessive gestational weight gain. Now, the Institute of Medicine talks about a weight gain guidelines during pregnancy. And I want to share these with you because I think it's really important that with a healthy lifestyle, we can actually prevent gestational diabetes. We can prevent excessive gestational weight gain. So this chart here shows that it is based on a pre-pregnancy body mass index, and these are listed here. And these are the BMI classifications in kilograms per meter squared. And this is what the total weight gain range is in pounds. And I've also got in square brackets kilograms for those of you that use kilograms. And what that means is, for example, an individual that is normal weight, pre-pregnancy BMI of normal weight, they should not gain more than 35 pounds or 16 kilograms. An individual with overweight should not gain any more than 25 pounds or 11.5 kilograms. And those individuals that are classified in the obese category, and that includes all classes of obesity, should not gain any more than 20 pounds or 9 kilograms. The Institute of Medicine also shared with us the rates of weight gain for second and third trimester. And again, I've got them in pounds, but in brackets here, in square brackets, is the kilograms. So, for example, again, a normal weight individual should only gain about 1 pound per week in the second and third trimester. And that's about 0.45 kilograms. An individual with overweight should not gain any more than 0.6 of a pound. And an obese individual, all classes, should not gain any more than 0.5 of a pound or 0.27 kilograms. And these guidelines here from the Institute of Medicine assume that the individual gains only about 4 pounds or 2 kilograms in the first trimester. And many women, many individuals in the first trimester of pregnancy actually gain excessively even before the second trimester starts. So I think this is something that's really important to bring to your attention. So if we think about this modifiable risk factor, and I mentioned that it was excessive gestational weight gain, if we can modify that through a healthy lifestyle, through physical activity, then we can change this to actually be adequately gained weight during pregnancy, adequate gestational weight gain. And we can also potentially prevent obesity. We can actually prevent gestational diabetes mellitus through engaging in physical activity. And we can also maybe even prevent, through this downstream effect, prevent in both the mother and the developing fetus and child type 2 diabetes, cardiovascular disease, and metabolic syndrome. So I want to share with you sort of the background information with regards to the guideline that we produced in 2019. It was a labor of blood, sweat, and tears for 3.5 years. It took us to put this together. We received funding from the Canadian Institute for Health Research, and we put together a consensus panel, a guideline consensus panel made up of 18 individuals that consisted of experts in the field, a panel of methodologists, and we had many stakeholders. For example, the two main players were the Society of Obstetrics and Gynecologists of Canada and the Canadian Society for Exercise Physiology. But we also had representation from the Canadian Academy of Sport and Exercise Medicine, College of Family Physicians, the midwives, the Middlesex London Health Unit, and Exercises Medicine Canada. And we went through very rigorous guidelines here for developing these guidelines, and we published this methodology in the Journal of Obstetrics and Gynecology of Canada if you're interested in seeing what exactly we did. So our panel basically talked about all of the potential outcomes that we might be able to examine. And we ended up with 20 critical outcomes. And these were both for the mother and also for the developing fetus, and also later with the child. And we ended up with 20 critical outcomes, and we ended up with 17 important outcomes. And again, this is all based on consensus from our guideline panel. And we searched primary sources up to January the 6th, 2017. We screened almost 30,000 titles and abstracts, and we ended up with 675 unique studies that were included in this for the guideline development. And we published 12 systematic reviews based on this primary data in the British Journal of Sports Medicine, and it basically took up 2 supplements. So the first one was published in November of 2018, and the second was published in January of 2019. And our guideline also was published jointly between the Journal of Obstetrics and Gynecology of Canada and also the British Journal of Sports Medicine. So they published it concurrently. And that was also published in the November issue of the British Journal of Sports Medicine. So as I mentioned, it was 3.5 years worth of work, and we were lucky to receive endorsement not only from the Society of Obstetrics and Gynecology of Canada and CSEP, but also many provinces endorsed our guideline document. The representatives that I mentioned to you previously, but also we had international buy-ins from Scotland and from Spain. And we also had buy-ins from the Ontario Public Health Association, Participation, and the American College of Sports Medicine. So what I can do is summarize for you these 12 systematic reviews, because what we came up with was that physical activity reduces the risk of gestational diabetes by 38%, gestational hypertension by 39%, preeclampsia by 41%, excessive pregnancy weight gain by 32%. We looked at depression, and we found that physical activity reduces the risk of depression by 67%. We also looked at urinary incontinence during pregnancy. It reduced the risk by 51%, and also in the postpartum period by 47%. Macrosomia, or very large babies, which can lead to a difficult labor and delivery, was reduced by 39% with physical activity, and also instrumental delivery. We saw a reduction by 24%. But the interesting thing was, when we also looked at fetal issues, we found that physical activity is not associated with miscarriage, stillbirth, or neonatal death, birth defects, preterm birth, preterm, pre-labor, rupture of membranes, low birth weight, induction of labor, neonatal hypoglycemia, or any kind of birth complications. And we also found that physical activity was not associated with changes in fetal heart rate or uteroplacental blood flow metrics. So this is really important for, I think, all of us if we are prescribing physical activity, because I think one of the barriers might be that pregnant individuals are afraid to be physically active because they're not sure what might happen to the fetus. But now we can say, without a reasonable doubt, when we looked at all of the literature, we can say that physical activity is actually extremely good. And it does not cause all of these particular things that we looked at. So when we take a look at physical activity and we look at maternal and fetal well-being, I like this diagram because what it shows here is a baseline where the quantity and quality of maternal exercise increases along this axis here. And what we see is a maternal dose response curve here in black. And as the quantity and quality of maternal exercise increases, again, bringing back what we found with our systematic reviews, we found that there is a decreased risk of gestational diabetes and hypertension. There's a promotion of normal glucose tolerance, and there's also psychological benefits. But there's also a fetal dose response curve in red here. And we know that there are fetal and placental adaptations that also occur in this particular area. Now, there is an optimum zone here that's based on the scientific literature, where there's an optimum zone for maternal exercise prescription. And that brings us to the Canadian guideline for physical activity throughout pregnancy. Now, one of the issues is that we don't know where this potential threshold where there might be a potential issue problem as we go beyond a certain threshold. We don't know the effects of, say, the elite athletes. And I'll talk about elite athletes in just a moment. But right now, I just want to talk about the recreational athlete and the so-called normal population that does not have any contraindications to being physically active. So we know that there is an optimum zone for exercise prescription. But one of the issues I think right now in our society is that individuals are not getting enough physical activity. So we're also seeing a potential threshold for maternal physical conditioning effects where individuals are not getting enough physical activity. And so we start seeing altered maternal pregnancy adaptations where we see this increased risk for gestational diabetes, for excessive pregnancy weight gain. And we also start seeing altered fetal development. So for example, we start seeing very large babies, or we start seeing very small babies. And so this, I think, is really important, especially considering a sedentary lifestyle and this physical inactivity that I think we see in our society today. So who should be physically active during pregnancy? there are absolute and relative contraindications to physical activity during pregnancy. And these again are based on clinical observation and potentially some scientific literature. And basically, the Canadian guidelines per se are intended for individuals who do not have contraindications to being physically active. Now, the interesting thing about these newer guidelines is that those individuals with absolute contraindications, so those listed here, may continue their usual activities of daily living, but should not participate in more strenuous exercise. And the list here with relative contraindications, an individual with relative contraindications should discuss the advantages or disadvantages of moderate to vigorous physical activity with their obstetric care provider. And I'll talk a little bit more about that when I talk to you about the Get Active questionnaire. So what are the recommendations? So the recommendations are, there are 6 of them. And again, these are based on the consensus panel and what we found with our systematic reviews. So the very first one, pardon me, is that all women without contraindication should be physically active throughout pregnancy. We also did some subgroup analysis, and we found that those individuals who were previously inactive can start. Those individuals with gestational diabetes can also be physically active. And those individuals that were categorized as overweight or obese can also start a physical activity program. We also found that physical activity during the first trimester did not increase the odds of miscarriage or congenital anomalies, like I showed you from our systematic reviews. And not engaging in physical activity from the first trimester actually increased the odds of pregnancy complications. So this first recommendation then is physical activity should be encouraged throughout pregnancy. And if you want to know more information, you can actually download these guidelines from the CSEP website. And if you want even more information, I would suggest that you take a look at the publication that we had in the British Journal of Sports Medicine from 2018. So the second guideline then, I put second and third together because I think they're very much related to each other. And the second one is that pregnant individuals should accumulate at least 150 minutes of moderate intensity physical activity each week to achieve clinically meaningful health benefits and reductions in pregnancy complications. And number 3 is that physical activity should be accumulated over a minimum of 3 days per week. However, being active every day is encouraged. And so what that means is every minute counts. So based on these 2 recommendations, lower intensity physical activity also has benefits, and therefore all individuals should be encouraged to be as much physically active as they can, even if they are unable to meet the guidelines. And the highest physical activity that we found in the literature was about 7 METs, or approximately jogging. And as I mentioned, the safety of chronic high intensity physical activity is not known, at least it's not well represented in the scientific literature. And high intensity physical activity is recommended only in a monitored environment. And so what comes down to is that moderate intensity physical activity is recommended throughout pregnancy. So what is moderate intensity physical activity? I think we have to define that, right? So moderate intensity physical activity, and this is based on the CSEP guidelines for moderate intensity, and it's intense activity that's intense enough to increase heart rate. So a person can talk but not sing during activity. If you've ever tried to sing during an activity, it's really tough to do. And so the examples that we present here are brisk walking, water aerobics, stationary cycling, resistance training, carrying moderate loads, household chores, such as gardening or washing windows. And the best ways to monitor intensity is maternal heart rate with pregnancy-specific target heart rate zones, and I'll talk about that in just a minute, or something called the talk test. And a talk test is important because if you talk to your pregnant client, they should be able to maintain a conversation during their physical activity. But if they can't, if they're out of breath, then they need to be reduce their intensity. So there are target heart rate zones for pregnant individuals. And again, this is in the British Journal of Sports Medicine document. And it is based on peak exercise tests in medically screened low-risk pregnant individuals. And these target heart rate ranges are based on maternal age, intensity of light, moderate, or vigorous, and it gives a target heart rate range. And that range is between 40 to 59% of target heart rate reserve for moderate intensity and 60 to 80% of heart rate reserve for vigorous intensity. So for example, if you had a client that was 25 years old and she had been exercising all the way along, then you can look potentially at the moderate intensity physical activity target heart rate guidelines. And so the range is 125 to 146 beats per minute. If she's an avid exerciser, perhaps maybe ran marathons in her previous life, you could maybe take a look at the more vigorous intensity activity. Now, there is minimal, as I've mentioned, minimal information regarding the impact of physical activity at the upper end of the target heart rate ranges, but these upper ends here based on age, we know is safe based on the literature. So number 4 is that pregnant individuals should incorporate a variety of aerobic and resistance training activities to achieve the best benefits, and adding yoga and or gentle stretching may also be beneficial. Number 5 is looking at pelvic floor muscle training. So an example of that is Kegel exercises, and these may be performed on a daily basis. And this has been shown to reduce the risk of urinary incontinence. But instruction is really important in proper technique to obtain the optimum benefits. And as I've mentioned, pelvic floor muscle training is associated with this huge decrease in risk of urinary incontinence for both pregnant and postnatal individuals. But it's really important that proper technique is employed. And the best way to do that would be to send your client to a pelvic floor physiotherapist. Number 6, and the last guideline, is that pregnant individuals who experience lightheadedness, nausea, or feel unwell when they exercise flat on their back should modify their exercise position to avoid the supine. Now, the evidence is extremely weak regarding the supine position. So what that means is, and I've got a diagram here to show you, is that an individual, a pregnant individual that is standing upright, you can see that there's no restriction here with the pregnant uterus of the inferior vena cava that's bringing blood back to the heart, or with the abdominal aorta. But as soon as you place her on her back, you can see that the pregnant uterus may in fact impinge on the inferior vena cava. And if it does, you will see symptoms because of that. She will start feeling a little bit lightheaded. But the problem here is, and this is where the literature is weak, is that it may also be impinging on the abdominal aorta, which is the major blood supply to the uterus and the fetus, but there are no symptoms associated with that. So we err on the side of caution. So it's just a little proviso here, just to be aware with regards to exercising on the back. So that doesn't mean that you can't do sit-ups. You can do sit-ups, but the best scenario would be a 45-degree angle so that you bring that pregnant uterus forward, or she can do sit-ups sitting, or she can do sit-ups in a lateral sideline position. So there are some considerations for implementation. And again, this is based on the expert opinion of the guidelines consensus panel, because a lot of this is actually common sense. So for example, The safety precautions are avoiding activities that involve physical contact or danger of falling with regards to fetal trauma. Avoid, but not limited to, horseback riding, downhill skiing, your obvious sports. Avoid non-stationary cycling, as this may carry a higher risk of falling due to changes in body mechanics. Alternatives are activities with less risk of falling. So again, common sense. Avoid vigorous physical activity in excessive heat, especially high humidity. And an example here is hot yoga. Warming up and cooling down is important. And it's very important to also watch ligaments. So the ligaments may become relaxed by a hormone that's released during pregnancy called relaxin. And so it's very important to be cautious with regards to a range of motion with flexibility. Resistance training, it's important to adhere to the safety considerations. And as I've mentioned, mixed interventions combining aerobic and resistance training maybe have better improvements in pregnancy outcomes than just straight aerobic exercise alone. And of course, with any resistance training, it's important to avoid holding one's breath. Athletic competition or exercising significantly above the recommendations the individual should consult with the obstetric care provider. Elite athletes who continue to train are advised to seek supervision by an obstetric care provider with knowledge of the impact of vigorous intensity physical activity, as I've mentioned, because there's very little scientific literature out there. I was lucky enough to be involved in the International Olympic Committee that pulled together a group of us, and we released a 5-part series of recommendations to guide the elite athlete, and that again was published in the British Journal of Sports Medicine. So this is the group, 16 of us, that the International Olympic Committee pulled together, and we met for 3 days in Lausanne, Switzerland, and it was extremely intensive. But basically what we found was there was not a lot of literature out there with regards to the elite athlete. And so the recommendation here is that there's a significant lack of high quality evidence, especially regarding the impact of high intensity exercise and extreme doses of exercise during pregnancy on maternal and newborn outcomes. And that's why it's extremely important that if you do have an elite athlete as your client, that you work very closely with their healthcare provider. Other safety precautions, and again, these are mainly common sense. Avoid physical activity in excessive heat. Avoid activities that involve danger of physical contact. Avoid scuba diving. Avoid going up into high altitudes greater than 2,500 meters. And I've already talked about the elite athlete, but those considering athletic competition should also talk to their healthcare provider. Maintaining adequate nutrition and hydration is important. And know the reasons to stop physical activity and consult a qualified healthcare provider. And these are the reasons to stop physical activity and consult a healthcare provider. And these are again very straightforward, and they're all listed in this British Journal of Sports Medicine document. And if they do occur, the individual must stop, exercise immediately, and seek medical advice. So how do you start being active during pregnancy? So previously inactive individuals can start gradually at a lower intensity and increase duration and intensity as pregnancy progresses. More physical activity, so fit and volume with frequency, intensity, time, and volume had greater health benefits. And the upper limit, as I've mentioned to you, is not established. So I think it's really important that you remain cautious with those higher levels. But physical activity does not need to be in a supervised setting or with specific equipment. Activities as simple as walking can have positive benefits. So I think the important thing with you and your clients is motivation and accountability. So have them, keep them motivated through face-to-face contact, either with phone calls or FaceTime. Get them to wear pedometers, or have them look at their Fitbits if they have technology tools, download phone apps, text messaging. There are other tools out there to enhance and promote healthy habits. And I think this is really important. And so when you think about it, 150 minutes per week is about 30 minutes per day, per 5 days a week. And so if you can get your pregnant client to do that, That's really, really important. However, what happens during the day and the other 23.5 hours? And I think this is really important when we think about daily activity. There's a great YouTube video by Dr. Mike Evans called Let's Make Our Day Harder. And it's a great way to increase daily activity. So if you have a chance, I suggest that you take a look at that particular video. I think it's really important. But there are ways to be physically active, and part of this is through Dr. Mike Evans as well. So increasing your steps that you take during the day. So park farther away, take the stairs, increase your steps through the use of pedometers. Pregnant individuals can rake the leaves, especially now that we're coming into fall. They can cut the grass, they can garden, they can shovel snow, as long as they use the proper technique, and importantly, they can play with their children. They can also check out their cupboards. I've got a picture here of those, those huge, gigantic cans of tomatoes. So while your pregnant individual is watching TV or reading a book, they can exercise, and they can actually do muscle conditioning activity. They can move muscles. And I think that's the key here, is to move major muscle groups. So key factors for exercise prescription, medical pre-screening. As I've mentioned, I'm going to talk about that in a moment. Pre-pregnancy body mass index, their age, their fitness level, what did they do before, what is their occupation, and what is it that they want to do. So if you think about start low, go slow, aim high, I think that's the mantra that I'd like to get you to repeat over and over, because I think it's really important that you engage your pregnant clients in what exactly it is that they want to start and what they want to continue. So the resources, the tools, I'm going to end off here with the tools for resources. And the Get Active questionnaire for pregnancy is based on the 2019 Canadian Guideline for Physical Activity throughout pregnancy, and also the healthcare provider consultation form. And again, these two documents are available from the CSEP website. So I just want to briefly talk about each of these two documents for you. There are 2 pages, each of them are 2 pages. They were released by CSEP on April the 15th, 2021. And they were designed to be a self-administered pre-screening tool to empower pregnant individuals to be responsible for their own health and well-being during their pregnancy. And this is replacing the old PARMED-X for pregnancy. You're probably very familiar with that. So this is replacing that document. And what this does is it assists in removing barriers to being physically active. So it's putting the onus back on the pregnant client, and it's taking the onus away from the healthcare provider, because that was a barrier to being physically active. So this first page here is basically a checklist. So the pregnant individual fills this out. They either answer yes or no. And on the second page, there is an area where they describe their physical activity level of what they've been doing. They may not have been doing anything at all. Asks how active they were 6 months before pregnancy, during this pregnancy, and what are their goals. So you can use that to your advantage with your client. If they check no on everything on the first page, then physical activity is recommended. If they answered yes to any of those questions on that first page, then they must speak to their healthcare provider. So this engages both the fitness professional, the pregnant individual, and the healthcare provider into a dialogue so that the pregnant client has the best pregnancy possible. And if you do have to talk to the healthcare provider, there is this consultation form. And again, it also has the absolute and relative contraindications on the first page. And then the second page actually tells the healthcare provider what those 6 recommendations are from the Canadian Guideline document. So to summarize here, what we see is a representing foundational shift in our view of physical activity. So we've gone from recommending behavior to improve the quality of life to now a specific prescription for physical activity to reduce pregnancy complications and optimize health for 2 and 3 future generations. And it's extremely important to implement this into clinical practice for the lifelong benefits for both mother and child. So I don't have to tell you this, but a healthy lifestyle is a balance. It's a balance between eating habits, and I usually tell my pregnant clients not to eat for two, but to eat twice as healthy, and think about portion sizes, and also think about being physically active. And it's really important to promote physical activity during pregnancy, because I borrowed this from Ann Geddes. My business is to grow healthy babies. And so I firmly believe that healthy moms equals healthy babies equals healthy futures. And I hope that I've convinced you that we need to start thinking about growing healthy babies to make a difference for both 2 and 3 generations. Thank you very much for your attention, and I'd be more than happy to answer any questions you may have.
Thank you very much. I see lots of reactions coming through the Zoom portal here, and lots of reactions throughout the presentation. So thank you very much for spending some time with us today. I think this has been excellent. And it's great to see the culmination of all of the evidence and all of the hard work that's gone into reviewing the evidence, but packaged in such a way that's so useful and so practical for all of us as kinesiologists. So for those that have been listening in and you have some questions, please feel free to type those questions in the chat. We're going to work through some of those now. Dr. Matola, some of these answers may have come up later after questions have been posed, but I'll present them to you anyway in case there's an opportunity to sort of build up from there. Through your presentation, you did speak a little bit about resistance training and some of the contraindications there, but one of the questions that was asked is, are there any resistance training which should be avoided or modified when pregnant? So if you want to expand on any of those comments.
Sure. Yeah, good question. I think anything that has to do with lying in a supine position, I think you need to be very cautious about that. So yeah, you can modify, again, you can have the individual on a 45-degree angle. You can keep them sitting upright. Obviously, you don't want them to lie on their stomach, and you don't want them to lie on their back. So I think, again, using common sense, and especially think about the later stages of pregnancy, right? Where now remember, she's got a big belly. There are several resistance exercises that might be really difficult for her to do. So what I usually do is I tell individuals that if you're thinking about prescribing resistance activity, to get a beach ball or a basketball and stick it under your shirt, and then think about the exercises that you're prescribing, and will a pregnant individual be able to do what you're suggesting when they've got this big basketball in their front? So again, it's a way of thinking about it, thinking of it in the way from the pregnant individual, and trying to adjust and modify your physical activity suggestions to her in that regard.
Excellent. I would have never thought about the basketball example, but that's a great way to put your foot in the shoe of the people you're working with. So that's a great idea. Another question from Taylor. Is there a certain point in the pregnancy, or maybe a specific trimester or week, that the supine position should be avoided? Or are we kind of thinking that the supine position can be tried throughout pregnancy? We just have to be mindful of that position.
Yeah, that's a really great question as well. If we base it on the evidence, like I said, the evidence was very weak. However, we did find some really interesting evidence with regards to acute supine activity, where some of the papers looked at fetal heart rate responses, and they found that there were decelerations in fetal heart rate. And so I think we need to err on the side of caution. So my advice is, even though it's a very wishy-washy kind of guideline, and we kind of had to do that because the evidence wasn't strong, but my advice is to err on the side of caution. And when we start thinking about that pregnant uterus and how big that pregnant uterus is and how it could potentially impinge, I would suggest maybe past 20 weeks of pregnancy, You may start thinking about not having her do any kind of supine exercise or modify it. Yeah, I hate to say that, but I firmly believe in erring on the side of caution.
Excellent. Thank you for that. We had another question come in around encouraging pregnant individuals to exercise. So I know you spoke a little bit about, the clients you're working with, how to stay connected with them, make sure they're engaging in physical activity. But do you have any advice for, what about the folks that maybe aren't engaging? And is there any advice or recommendations that you have, to help them maybe understand that exercise isn't dangerous for the fetus and maybe that's a barrier? If you could speak to that, motivating those folks to engage in exercise in the first place.
Yeah, I think education is key. So we've got the advice, we've got the evidence now. So download the published paper, and you can show individuals what we found with the scientific literature. So they should no longer be afraid to be physically active if they've got no contraindications to being physically active. And I think it's also really important that you can get them to walk. Walking is a marvelous aerobic activity, and I think a lot of people forget about that. So just get them to walk 15 minutes a day, and they'll start feeling better about themselves. And I think if you can motivate them, and remember, every minute counts, right? So if you can just start them at 15 minutes a day and then increase, we usually suggest increasing 2 minutes every week till you get to 30 minutes, 5 times a week. That's your 150 minutes. Or you can do maybe 10 minutes in the morning and 20 minutes in the afternoon. You know what I mean? Like you can change it up a bit, because I think it's really important. If you think about that, every minute counts, then you can ask her what she would like to do. And I think that's really important, that you engage your pregnant client in participating in deciding what that prescription might be.
Excellent. I continue to thank you for all these responses. I think this is fantastic, fantastic advice that immediately affects practice. So this is all wonderful. Just on the note, you mentioned the value of, sharing that, like printing the cover of the paper and saying, hey, like, look, there's evidence here. Really valuable. I just wanted to note for all the audience members, in addition to Dr. Matola's efforts today to speak to us, she's also been working hard behind the scenes with Sophie Pham, our Keen coordinator, to update our Keen resources. So for those of you that are looking, I know we put the link to the paper in the chat, but you can also access it through the Keen platform by searching for the Pregnancy and Exercise Best Practice Guidelines. So if you didn't get it today, don't worry, it's still there. So to Dr. Matola's point, you can find that evidence and really showcase them. But we still have you for a couple minutes. I have a few more questions. I don't want to let you off the hook yet.
Yeah, no, I'm here. Go ahead.
Excellent. So historically, thinking from the lens of the PARMED-X for pregnancy, there was some guidelines around avoiding isometric exercise. Is this related to large muscle groups and or maybe, holding your breath, that Valsalva move you talked about? And maybe, would this still pertain to smaller muscle groups, deep neck flexors, that sort of thing with some isometric holds, which I should probably be doing myself right now?
Yeah, so the PARMED-X was relating to holding of the breath. So isometric exercise is fine as long as they breathe through the activity. But again, I think it's important that you think with the pregnancy, you don't want to increase muscle mass. You don't want to bulk up during pregnancy, right? So what you want to do is maintain strength, and you want to maybe improve strength, because don't forget that at the end of the pregnancy, the individual, once she delivers, is going to be hauling around a 10-pound baby, or hopefully not 10 pounds, but an 8-pound baby. And if they're not used to that, you may want to think about improving upper body strength. And you can do that through not isometric, but isokinetic exercise, right? So I think you need to rethink some of those things. Like, what would be the best thing for your pregnant client? Improving muscular strength absolutely. And to prepare for when she has to actually carry the infant around.
So we actually have a couple questions that pull on that thread a little bit further in a couple directions. One of them was around physical activity and the effect on muscle hypertrophy and bone mass density. Does exercise still have the same benefits in terms of hypertrophy and bone mass density? Is there research to talk about that maybe you could touch on for us?
Yeah, interesting question. We do know that weight-bearing activity is good for bone health during pregnancy because one of the things that happens is that pregnancy changes absolutely every system of the body, including the digestive tract, bone resorption, bone formation, and calcium absorption in the gut, because the calcium is necessary for the development of the fetus cartilage and bone. And so that's why bed rest is a real major issue, not only for the pregnancy, but also for the mother after the pregnancy is over. So we no longer advise bed rest or activity restriction. And you notice that even with the absolute contraindications, the individual is still able to go about daily activity. So weight bearing and daily activity is still really important, even though an individual may have contraindications. So that's one of the issues. And I think it's really important that we think about maintaining strength, think about weight bearing activity for that exact reason.
So on the note of weight bearing activity and sort of sticking with the resistance training theme, there's been a lot of, maybe talk around heavy lifting, especially in the first trimester. So could you speak a little bit to recommendations around, the intensity of what people are lifting in a resistance context with respect to the exercise guidelines?
Yeah. I hate heavy lifting. And the reason is because as an anatomist, and you think about the joint laxity, I think you're putting the joints at risk in the pregnant individual. And then you have to say, well, why do you need to do that? Why do you have to do heavy lifting during pregnancy? What is the point of this? And if it's not going to improve the health of the mother, and it's not going to improve the health of the baby, why are you doing heavy lifting? And the literature, there is no literature that I've seen, very few studies have looked at the impact of heavy lifting on mother and fetus. And so my advice is that because we have no literature or very little literature about heavy lifting, I would not recommend it during pregnancy because I can't see the benefit of doing that.
Yeah, good point. And great perspective. Just following on that, you mentioned a little bit about, the issue or the concern, I guess, of increased joint laxity. One of the questions from Christian asks, is it safe for pregnant individuals to perform open chain exercises? So like single leg exercises, should we be concerned about that from a joint ligament laxity perspective?
I don't think so, but again, there's nothing out there in the literature about single leg exercises. But I think you need to use common sense, right? So if you exercise one leg, then you need to do the other leg, right? You need to keep your balance in place. And if you're strengthening muscles, then you need to strengthen all muscles. And because you want an overall body effect. And I think that's really important. And one of the other things I should mention too is that moving large muscles is really important with respect to preventing gestational diabetes. Pregnant individuals will, in a normal pregnancy anyways, have a little bit of insulin resistance. And so by moving large muscle mass, you will use that muscle as a sink for the excess blood glucose. And so it's really important that you think about using large muscle groups instead of, just small muscles, but think about working large muscle groups to maintain metabolic balance in pregnancy.
Yeah, and I think that's a great comment and really, echoes what you just mentioned about what's the purpose of the exercise and that focus on big muscle groups for exactly the reason you mentioned, so valuable. So the last one, and then we'll let you off the hot seat on the resistance training, a couple other potpourri questions here at the end. And do you, based on everything you've done and all the surveillance work you've done, surveying of the literature, do you have any referral sources that you might recommend around cardiovascular or resistance strength training programs, protocols for pregnancy that you've seen that that folks might want to check out?
Yeah, I think you can use any type of cardiovascular or resistance training program as long as it's modified for pregnancy. And again, that comes back to yes, there are many programs potentially out there, and even if there are some out there in the YouTube or whatever, go through them first and take a look at whether or not you think those particular activities are safe, because you're going to see all kinds of stuff out there, and with no scientific evidence behind it, the individual may just have had a baby and I did this in my pregnancy, so therefore you should too. So I think you need to be very cautious. So you could design your own program based on what you learned today. Think about what the pregnant individual wants. It could be trial and error. Will it work? Will it not work? Try it on yourself with a big basketball and see if it works for you. But I think most exercises for the non-pregnant population group, I think most of them are safe. I say that with most. But again, you have to use common sense and you have to think about your pregnant client. Is it doable? Is it feasible? Is it safe? And I think safety is a huge component here. When you think about her potential laxity, joint laxity, potential effect on the fetus, think about heart rate. What's her heart rate while she's doing all of this? Is she within the target heart rate zones based on age, based on fitness level? So there's a number of things that you need to think about while you're designing an appropriate exercise program for a pregnant individual. And it's individualized, right? So it may be good for one pregnant individual, but maybe not for another. And she may want to swim instead, which is fine. And again, that's something I didn't mention, but sometimes weight-bearing activity can be really hard on pregnant individuals. And so you may have to switch them to a body weight supported activity such as stationary biking or swimming. But the point there is that they're still moving large muscle mass, right? So, so you just, again, it has to be individualized to the wants and the needs of your pregnant client.
Excellent. I know we're just getting to their time. There's two more questions I'd like to pose to you here just briefly, and then we'll wrap up. Really interesting question, Dr. Mottola. Is there any evidence around the relationship between physical activity and the risk of postpartum depression?
Yes. So we looked at that with one of our systematic reviews was looking at depression and anxiety in pregnancy and postpartum. And we did see that with physical activity, there was a decreased risk in postpartum depression as well. So physical activity during pregnancy and in the postpartum period is extremely important. Yes.
And I guess kind of a related point to this, and coming from the perspective of the Ontario Kinesiology Association, where we're trying to support our kinesiology community in advocating and helping create more opportunities for us as ARKINs to help folks of all stripes achieve physical activity. Any thoughts or guidance on what we can do as an organization to approach midwives, OBGYNs, to help have that conversation around, how do we maybe engage this engine of kinesiologists that are attending the seminar today? How do we engage them to help help contribute and help increase physical activity for our pregnant clients?
Yeah, it's a great question. And I've been dealing with that question for years. I think the best thing is education. So now we've got 2 new tools that are based on evidence that are, and I think education is the key, right? So download the Get Active questionnaire for pregnancy and download the companion healthcare provider document. And I think if you can educate your midwives, your family physicians, it's going to take a little bit of legwork, but there are many resources that you can, like even just downloading the British Journal of Sports Medicine Canadian guideline document and share that with your physicians or your midwives and just say, look, I'm here for you. I'm going to be working with pregnant clients, and I want us to be on the same page. So is there a way that they can then recommend to you their pregnant clients so that you can assist them and help them in maintaining a healthy lifestyle? I think the midwives would be more amenable to something like that because they do talk a little bit about a healthy lifestyle, and they've got 40 minutes with a pregnant client. Physicians maybe might not be so much because they only have 15 minutes and there's a lot to talk about in 15 minutes. But if you can at least talk to your healthcare providers that you're dealing with and say, look, just have them come to me and I can deal with that as a consult. And then share with them the results of that particular individual. And they may be very happy with the results.
Wonderful. I think that's excellent advice for everybody on the call. And just as we wrap up here, Dr. Mottola, I just, again, on behalf of the Ontario Kinesiology Association, I want to thank you so much for not only the time you've given us today, but for all the time in the background that the folks in the call haven't seen, working with our team to help make sure that the evidence that we give to our kins is recent, contemporary, up-to-date, and as wholesome and fulsome as it can be. So I see lots of reactions again. Thank you very much. Wonderful talk. Again, we talked about this before we jumped on the call today. As a biomechanist, I'm actually excited about exercise physiology. So you've almost converted me. Again, almost. But fantastic. Really appreciate it. Thank you so much.
Thank you very much for inviting me. Really appreciate it. Bye, everyone.
Great. Have a good night, everyone.